Hello everyone. So today I'm going to show you how to fabricate lingual arch form with the compensation bends while doing the extraction space closure. So for that we are taking 1622 TMA wire. So for fabricating the lingual arch form I'm using the De La Rosa plier. So in the 1622 TMA wire, it is having width and depth component. The width component is 016, that is the thinner part, and the depth component is which is broader, that is 022 part. So while we are doing the bending, we need to bend on the thinner portion, that is 016 side. Like this. So this is the method for fabrication of lingual arch. So the main important thing what we need to check in the rectangular wire is the plane. So in the round wire, some amount of deflection, if it is there also, it is acceptable. But in the rectangular wire, it need to be perfectly in the plane so that we don't get any unwanted type of torque or plane variations while we are going to engage into the patient. So after that, when we see, it need to pass in this way through the fossa in the posteriors. So now when it comes to the fabrication of bends, see, we are giving the bend when we are using with lingual offset bending plier to make the bend. I am giving the marking distal to the canine and midline point also. So the place where I am marking, to that place I am engaging the middle notch of the plier, and when we give the press exactly there, we are going to get the bend. The same thing even on the opposite side also I am giving as a bend. So now this is after fabrication of the lingual form without any of the compensations. So but when we are trying to engage in the patient and we try to retract the anteriors by taking the support of molars, bypassing the premolar, so all the load is going to be taken by these molars. So automatically what will happen is this molar is going to get mesial out, distal in rotation tendency. At the same time it is going to get mesial tip also is going to get. So this rotation tendency which is going to happen on the molar, we are going to be compensated by the horizontal compensation bend, and in the mesial tip which is going to happen, we are going to compensate by giving the vertical compensation bends. So how to give the horizontal compensation bend? Same, we will take the De La Rosa plier, and after the mushroom bend which we have given, we are going to engage like a smooth curved horizontal compensation bend like this. So this is horizontal compensation bend. So when we are seeing, it tries to make the molar to get like mesial in and distal out. So when you are giving like as a retraction force, automatically these two forces will get nullified and we are going to get a stable position for the molar. At the same time, for the vertical, we are placing the plier on the broader aspect and giving like this as a vertical compensation bend. These bends varies clinically from one patient to another patient depending on the molar position, how it is being done. A simple thing is like after giving, when we check from the molar without any of the force, it need to be like this in the vestibular area. So this is vertical compensation. So when we see, it is being compensated both in the horizontal and vertical. So when we are engaging in the patient and when we are giving like as a retraction force, automatically these two things are going to be compensated and get a bodily type of retraction without any adverse effect on the molars. After we get the retraction completion, then we are going to do the engagement of the premolars and finishing bends into the remaining wire component. So this is how we will plan for doing the space closure in the extraction conditions. Thank you.